Hi, I'm Dr. Judy Morgan. Today we're going to talk about the pros and cons of neutering your dog. In America, we have a huge problem with overpopulation of dogs and cats because people are not responsible and don't keep their intact animals from breeding willy-nilly, and so that's a huge problem. In Europe, a huge percentage of dogs are left intact, and they don't have the overbreeding and population problems that we do in this country. So for years, as veterinarians, we have recommended that people spay and neuter their pets early so that we can decrease the overpopulation and stray population in this country. However, I think that we are doing a disservice to our pets when we perform this early spay-neuter. Particularly now, because people are so irresponsible, most shelter and rescue groups will not adopt out a pet unless it has already been spayed or neutered. So because of that, a lot of very young puppies and kittens are being spayed or neutered at very early age, some of them as early as 8 weeks old. And so we have to look at that and say, what kind of problems are we going to see potentially later in life? And we've been doing this long enough now, and there have been enough studies to show that there are some huge problems associated with the early spay-neuter of pets. So today I'm going to talk about the neuter of the males, and then I'll do a separate video for the females because there are some differences. So what are good reasons to neuter our male pets? Well, obviously overpopulation is one of the big ones. People say that by neutering early, you'll decrease the testosterone in the body, which is true, but that'll also decrease unwanted behaviors like mounting or roaming or chasing all the females. It'll decrease aggression. Well, let me tell you, I see a lot of neutered males in my practice who still have all those unwanted behaviors, who are still aggressive and have other problems. I think that the aggression problems are more related to poor training or no training, so I would prefer to see someone get their pet trained to solve that problem. So in neutered males, we do see less incidence of perianal fistulas, which are really ugly tracts where poop basically leaks through new holes that are around the anus instead of the poop coming through the anus. So perianal fistulas are a big deal, and they're common in certain breeds, really common in the shepherd breeds. But I think diet has more to do with that than anything else, so that's another topic. Perianal or perineal adenomas are small tumors that we see around the anal area that are definitely related to having an excess of testosterone. However, I have seen them in female dogs as well. Perineal hernias are another problem that we see in older unneutered males, where the muscle walls on the back end of the dog get really, really weak, and sometimes the hernia will become large enough that the bladder will actually come back through there, or a loop of bowel will come through there, and that's a big problem. Benign prostatic hypertrophy, or BPH, which is basically an enlarged prostate gland, can be seen in older unneutered males. Usually doesn't cause a whole lot of problems, but they can abscess, they can develop cysts. Neutering will solve the problem if it does occur. And certainly there would be no risk of testicular cancer in dogs who don't have testicles anymore. However, now that we have the pros, what are the cons? And particularly we're talking about early neuter. So if we're neutering these pets before they reach maturity, and maturity is different for each breed of dog, but maturity can be anywhere from 1 to 2 years of age. So when these pets are being neutered prior to reaching maturity, we are seeing increased risk of hemangiosarcoma, as in like 2 to 3 times the increased risk of hemangiosarcoma, and that can be cardiac or splenic. We're seeing 3 times increased risk of hypothyroidism. And in some of my other videos, we talked about endocrine disease, and I think the increase in endocrine disease that we're seeing is also related to the overuse of chemicals and the overuse of vaccinations and a lot of other things that are attacking the endocrine system. But certainly neutering will contribute to that as well. There's been an interesting study that showed there was an increased risk of geriatric cognitive impairment. So dementia or senility in old dogs can be related to having been neutered too early. We see 4 times the risk of prostate cancer in neutered dogs. Doesn't seem like it would make sense, but the hormones being there actually protect these dogs from developing prostate cancer. We have a twofold increased risk of urinary tract tumors, particularly bladder cancers. And we see a big increase in risk of orthopedic problems. In these dogs that are neutered prior to reaching maturity, there's delayed closure of the growth plates. And so the long bones can develop to be longer, and that makes for abnormal joint conformation and pressure on the joints. So we see an increased risk in hip dysplasia, increased risk in ACL tears, and increased risk in patella luxations. So orthopedic problems are huge in neutered dogs, and if we let them reach maturity and delay that bone or increase the speed with which those bones, the growth plates close, then we may be able to help avoid some of these problems that we're seeing. There's also a 3 times higher risk of obesity in dogs that are neutered. And, nobody's really sure what the risk or the link between obesity and diabetes is that is occurring. However, it's usually fat dogs that I diagnose with diabetes. There are also dogs that are eating an inappropriate diet that's high in carbohydrates and grains. So I think there's a link there. But neutering will definitely kind of slow down the metabolism and increase the risk of obesity. So you're the one in charge of opening the cover and filling the food bowl. So make sure that you are filling the bowl with the appropriate number of calories, and they may have to be decreased for a dog who's been neutered and maybe their activity level has decreased some. So before neutering your pets, take all these things into consideration. Decide whether you're a responsible pet owner and you can keep your male dog from roaming the neighborhood and impregnating all the females down the line. And I think that at least waiting until maturity before neutering is a really good idea. So for my responsible pet clients, I do recommend waiting until the dogs are about 2 years old before we consider neutering. For the irresponsible pet owners, we're going to do it early. But I'm really not a fan of this neutering at 8 weeks old. I do work for the local shelter, and we will neuter those pets at 8 weeks because we need to get them into homes instead of having them languishing in the shelters. We tried having people prepay for the neuters. They don't come back. 2/3 of them did not come back even though they had prepaid. Big problem. And then they're also sometimes not the most responsible pet owners, and so those dogs are just, running around the neighborhood impregnating all the females. So be a responsible pet owner, and if you really care about the health of your pet, delay that neutering until they've reached full maturity, and then take care of it at that time. If you're seeing behaviors that you think are related to the testosterone hormone, get a good trainer to work with you. Don't immediately go to surgery. Talk to someone who can really help make your pet a model citizen. Take care of your pets. Take care of yourselves. Talk to you soon.